Good afternoon, everyone, and welcome to the June meeting of Mecklenburg County's Health and Human Services Committee. Certainly welcome those who are online, and for those who are here in person, welcome. As we get started, I'd like to have the committee members introduce themselves first. Then we'll have the executive team and those who are not presenting to introduce themselves as guests, and we will then start our agenda program. First of all, let me go to my right and ask my committee member to introduce herself, and then our visiting committee member, who we might adopt one day, can introduce herself.
Good afternoon, I'm Laura Meyer, and I represent District 5.
Hello, I'm the hopeful adoptee someday. Commissioner Susan Rodriguez McDowell, elected by the people of District 6.
All right, I go to Ms. Henderson. If you please introduce yourself, and then the other executive team can introduce themselves.
Good afternoon, Kim Henderson, Director, Child, Family, and Adult Services.
Good afternoon, Stacy Lowry, Director of Community Support Services.
Good afternoon, Raynard Washington, Public Health Director.
Good afternoon, Taya Cruz, Assistant to Deputy Manager Trotman.
Hey, good afternoon, everybody. Robert Nesbitt, Chief of Staff for our Health and Human Services Agency.
Good afternoon, Yolanda Griffin, Director for Department of Community Resources.
And our guests who are not presenting.
Greg Tanner, Division Director for Services for Adults.
Taya will get me if you don't speak into the microphone. She keeps copious minutes.
Greg Tanner, Divisional Director for Services for Adults.
Mary Wilson, Program Director of CORA's Intergenerational Center and Adult Day Health Center.
Miles Bell, Public Information at Public Health.
I'm Alex Burnett with the County's Public Information Office.
Thank you. We have one lady over here. That's
Michelle Allgood, Executive Director of Gracious Living Adult Day and Healthcare Center.
welcome to everyone, and thank you for joining us this afternoon. This is an extraordinarily important topic. We heard a lot about in-home aid, but specifically adult daycare during our budget hearings, and I thought it was just a good opportunity to kind of roll back and kind of take a deeper dive and hopefully learn some more things about adult daycare. Before that, I need to call for an adoption of our minutes. Unfortunately, we don't have that third person to make a quorum, so I'm going to skip that, come back to the minutes, and go directly into our presentations, if that's okay with you. Ms. Henderson?
Thank you, Commissioner. Delighted today to have members of the Services for Adults team here to brief the committee on our in-home aid and adult daycare program. We have Shannon Myers, who is our Assistant Division Director for Services for Adults. She will lead the presentation, and she will be backed up by Renee Dutcher, who is our manager within Services for Adults.
Well, welcome, ladies. Thank you.
Good afternoon, Chair Griffin, other members of the Health and Human Services Committee, our Department Director, Kimberly Hemberson. My name is Shannon Myers. I am the Assistant Division Director for Services for Adults, and I'm joined by Renee Dutcher, our Program Manager. And we are pleased to be with you to share information regarding our in-home aid and adult daycare programs. So during this presentation, we're going to talk about both programs. We're going to give you an overview of the programs, talk about the service delivery process. We'll provide some snapshots of services to let you know who we serve and how we serve them. We'll look at the FY24 and 25 budget, as well as look at the outlook for both programs moving into FY25 and 26. So we'll start with in-home aid. Excuse me. There's 3 levels of care for in-home aid. The first is our chore level. Excuse me. And this is typically for our clients who need assistance with laundry, housekeeping, shopping, non-personal care services. Level 2 is personal care. And this is going to provide assistance with your activities of daily living. So bathing, toileting, dressing. And then that third level is extensive personal care. And this is primarily for assistants who are bedbound, chair-bound, and need total care. We have contracts with 5 different agencies: Always Caring, Comfort Keepers, Home Watch Caregivers, and Interim, and Senior Helpers. Our contracts with these agencies are done through a request for proposal process. And so our last one was done in FY23. Each of these vendors will be with us for at least 3 years, with the option for 2 additional 1-year extensions. We serve currently 225 clients, and we have 350 individuals on our inquiry list. And just to kind of share about what an inquiry list is, this is a list of the individuals who have indicated that they are interested in services. And this differs from a wait list, where we are using that list to add new clients to services. One of the special features about a wait list, as indicated by the state, is that every 3 months, we have to reach out to everyone that's on that list, check their status, excuse me, and provide updates. But we are currently not adding new clients to In-Home Aid, so we maintain this inquiry list just so we know who is in need of services. In-Home Aid is state mandated for adult protective service clients. So any individual that needs In-Home Aid as part of their protective plan must be provided that service, and it's discretionary for all other referrals. An interesting thing that we also need to share about In-Home Aid is that we do not serve clients with Medicaid. Medicaid clients have the option to use personal care services or the CAP program for their services. So we focus solely on those individuals who do not have Medicaid. So a snapshot into the In-Home Aid program. The average age of our client is 74 years old. Average cost of care is about $21,000 a year. If you look at the third bullet, it talks a little bit about the 3 levels of care and the authorized hours for that care. So for chore services, we typically authorize up to 3 hours a week, and we currently serve 3 clients with this level of care. Personal care, which as you can see is our greatest utilization, we have 209 clients, and they're able to receive up to 14 hours per week. And then we have extensive personal care, and we have 13 clients, and they are authorized to receive up to 17 hours per week of care. We wanted to highlight the zip codes that have the greatest utilization. And so that's that 28205, 28208, and 28216 area codes. So this is the process for In-Home Aid services from beginning to finish. We receive intake and referral from our Just One call line, which is the gateway for all of the services within Services for Adults, or through an APS referral if it's deemed that service is needed for our plan of protection. And so the assessment process is done in conjunction with the agency registered nurse, as well as a DSS social worker. And so the DSS social worker is really focusing on assessing the physical and mental health, home environment, support system and needs, and determines eligibility for the In-Home Aid service, as well as any other resources that might be needed to support that individual. The agency RN assesses for the state policy requirements. So that's looking at reviewing their medical history, determining what support needs and tasks are pertinent to their care, and then the hours and frequency in which they'll be seen. So once we have both of those assessments, we create a service plan that's based on the recommendations of both the DSS social worker and the agency RN. Once they are into service, we have mandated home visits that must be conducted. So the agency is required to see their clients every 60 days, and DSS is required to see our clients at a minimum every 90 days. And then from then, there is an annual service plan and review evaluation just to make sure that the current service is meeting their needs, if there needs to be adjustments. This is just a
Shannon?
map to highlight.
Shannon,
I'm sorry, yes.
can you speak up a little bit, please?
Oh, sure.
Thank you.
This is a map to highlight those zip codes where we see the greatest utilization. Again, that's in 28216, 28208, and 28205. And from this map, you can see, based on the area, approximately how many clients we're serving in those areas. So this takes a look at the in-home aid budget for FY24 and FY25. As you can see, the funding is primarily based through county funding, HCCBG funding, and federal funding. You'll see in FY25 that amount is higher than FY24, and that is a result of an increase in funding of $356,000 to ensure that we can maintain services to current clients. Other important factors to note regarding the budget for in-home aid, in FY23, the in-home aid agency's reimbursement rate was increased. And this was really in response to insufficient aid services and to better align with the current market rates, specifically looking at the VA Medicaid and CAP. So in FY23, we increased the rate from $22 to $30 per hour. Okay, so we'll move to adult daycare. We are currently serving 160 clients, and we have an inquiry list of 150. We contract with 6 centers: Blessed Assurance, Cora's Intergenerational, Gracious Living, Loving Touch, Ray's Place, and University Adult Daycare. Adult daycare is a non-mandated service, but we will use this service for any clients that are in need of this service as part of an APS protection plan. What's important to note is that we do not do RFPs or requests for proposals for adult daycares. We offer to contract with any facility that receives DHHS certification. And so we want to make sure that we do this to ensure that our clients have options, in the size of the facility that they attend or the location that best meets their needs. Funding for adult daycare outside of the funding that could be received through DSS includes private pay, CAP-DA, VA benefits, long-term care, or private pay. And that's long-term care insurance. The process for adult daycare is very similar to the process for in-home aid. Again, the adult daycare staff and the social work staff work together to assess those needs. And then based upon the assessment of both the agency and DSS, we create a service plan. For this particular service, the mandated home visits are required by DSS. And again, it's at a minimum of every 90 days. We'll look into the adult daycare program. The average attendance is about 5 days a week. Of our current clients, 73% of them are over the age of 70, 41% are over the age of 80. Eligibility for this service requires that the individual require medical monitoring or 24/7 supervision. So our clients that attend adult daycare are typically more medically fragile than the clients that might attend a senior center. The average cost of care for the clients in this program is about $21,000 a year. And if we're looking at utilization, the zip codes of 28215, 28216, and 28269 have the greatest utilization in terms of clients. This map provides a pictorial view of where our adult daycare centers are listed. You'll see that Gracious Living has 2 sites that are coming online, one in South Charlotte on Nations Ford Road, and then one in Pineville on Park Road. And I think they are still in the certification process, but they should be coming online soon. And again, clients have a choice. They're able to decide which location they want to attend that best meets their needs. So looking at the adult daycare budget, you'll notice that again, this is funded through county, HCCBG funding, and state and federal funding. One thing that you'll notice is that in FY25, the funding decreased. And this is simply a realignment of funds. The demand for in-home aid is greater than the demand for adult daycare. So those funds were aligned to address that demand. Very important to recognize is that in FY23, North Carolina lifted the state cap for adult daycare reimbursement. And that hadn't happened in 18 years. So the centers were able to increase the reimbursement that they receive from $40 to $84 a day. And so in looking at our collaboration with other divisions in FY '24, we wanted to be more intentional, more efficient in the ways that we manage and administer our services. And so we've partnered with the Operations Strategy and Innovation Division within CFAS to look at how are we administering our programs, how are we serving our clients so that we can be more efficient and serve them in the way that they need to be. So we've engaged in some process mapping to address our inquiry list. We have a dashboard that we created for adult daycare and in-home aid. And this is really wonderful because it provides us with demographic information about our clients. It tells us about utilization. It shows spending and trends so that we can be more efficient in the way that we deliver services. And then we also partner with OSI and our finance team to make sure that we are monitoring the budget monthly. And then as we look towards this coming fiscal year and beyond, we want to continue our communication with our clients and our caregivers and review our customer service surveys to make sure that our providers and centers are meeting their needs. We'll continue to collaborate with the centers and the other agencies to offer resources for support groups and enhanced caregiver education. We plan on maintaining the current service level that we have with our existing clients, as well as supporting new clients who might be in need of either service as part of their APS protection plan. And then we'll have ongoing evaluation of the trends in services and demand as we plan for what FY '26 will look like for both of these programs. That's the end of our presentation.
Well, thank you very much. It was a very thoughtful presentation and timing was perfect for these questions that I know I have a few, but I will yield to my colleague, Commissioner Meyer, to start off. But before she asks her questions, help me with the mandate thing again so that I got that squared away. In-home aid
Yes,
is mandated.
for adult protective service clients.
Okay, so APS says, hey, this individual needs in-home aid.
Correct. Yeah, so if it's part of their plan to keep them safe, then we must offer it to them.
And they're non-Medicaid?
Non-Medicaid. Because anyone that has Medicaid could receive these same services through other programs.
Okay. All right, I'll come back to that. Commissioner Meyer,
Thank
please.
you. I first want to say this is a very valuable presentation because I've been here for almost 4 years and I didn't know anything about our program. So thank you for doing this. I really appreciate it. And my question actually is exactly what Commissioner Griffin was just saying. So adult protective services, can y'all explain adult protective services?
Sure. So what happens is that someone will make a referral with allegations that an adult is being abused, exploited, or neglected. And so if through the course of that evaluation, we identify that one of the ways to keep that adult safe is through in-home aid or adult daycare, that will be part of their protection plan.
And so daycare as well, even though.
Correct.
Okay. And so back to the Medicaid question, we don't serve individuals with Medicaid, but if they are in the adult protective services, we do.
Correct.
And if they, and besides them, how do they pay? Out of pocket or with their insurance?
So I'm going to defer that to Renee.
So if they come in,
You have to get on the microphone.
So let me see if I'm clear. So if they've been identified through Adult Protective Services and then they need service, or they are individuals who may have come on for services because a caregiver or a client says, I have a need and I want to stay at
Right,
home.
right.
That is when the spreadsheet that we kind of showed you, the graph that we showed you with the budget, it is funded through HCCBG dollars, county dollars, and federal dollars.
Okay, so
we
it's
do not go
basically
through
free for
private
them.
pay. Because we try to work with the client, serve the clients and their families who do not have Medicaid, but cannot afford to private pay for in-home services. So it's kind of that working class population that is
Okay.
our target population.
And so it's at no cost to the individual or the family. Okay.
Correct.
And HCCBG, what does that stand for?
The Home and Community Care Block Grant.
Okay, and that comes from
that comes from Older Americans Act dollars.
Okay. It's a lot of stuff I don't know. Okay, and so when we had our public hearing on our budget, we had a lot of adult daycare advocates who spoke to us. And I'm wondering, are y'all familiar with that evening? Were you there or did you listen? The reason is because we had several who, were you there?
I was listening.
Okay, so we had several who, I'm not sure if any of those were asking for money, or if we are already partnered with them.
My understanding, Commissioner Meyer, the broad takeaways from that set of hearings and the public participation there was largely around expanding access. And so we showed in the PowerPoint an inquiry list, I think it's 150 right now. And so it really comes down to the funding to support. There was a reference to the reimbursement rates being raised. And so frankly, our dollar isn't going quite as far. It's great that the rates were raised because historically they had been capped for 18 years or so, but that translates into the stretch not stretching quite as far. And so much of that public participation was just in support of being able to pull more individuals into the ability to participate in adult daycare. If you're an APS client and that's a part of your plan, we make it happen regardless. But right now there is an inquiry list of about 150 as we serve ongoing about 150.
Okay, so there's always a need for more
That's right.
funding.
Yes, and again, the reimbursement rate increase was a great thing because it met the market need for individuals who are willing to work in this space and do this work, but it also translated into an impact on how many we could serve with the funding that we have.
Okay, all right, that's all for now, thanks.
Commissioner Rodriguez McDowell.
Thank you so much, Mr. Chairman. So picking up on that, so who sets the rate? Is that a federally set rate or a state set rate, or do we set the $30? Did you know that? Is that us?
So we set the rate. Prior to us being able to set the rate, that was a state cap, and that was capped at $40 per day. And so in FY23, when that cap was released, we were able to increase the rate to $84 per day.
Oh, 84 per day. So it's 30 per hour or 84 per day?
Those are separate. So the in-home aid is
Oh.
$30 per hour.
Oh, that was the in-home.
Yes.
Okay.
And then adult daycare is $84 per day.
Oh, okay, gotcha. Okay. And so in both cases, the client doesn't contribute at all, even for either one. Okay.
Correct.
If people wanted to pay for it, could they? I guess what I'm trying to figure out is there a way for us to expand what we do at the rates that we do them if clients could opt into that? Is that I guess
There
the
is
law or
something as
something?
part of the
Just go through.
community, as part of the Home and Community Care Block Grant, which is called Consumer Contributions, which is a voluntary opportunity for them to contribute to their services. And with those funds, we could expand. But we're also looking at individuals who have an income of maybe $1,400 a month, $1,500 a month. So there's not a lot of discretionary monies. But upon their initial assessment, and then every year, the clients and their families are given the opportunity to contribute to the cost of services. Yes.
Okay, let me just make sure I'm understanding. So these folks who don't have much discretionary spending are given the option, if you'd like to spend some of your discretionary spending, we'll take it. And then that would open up more spaces for others?
Correct.
Oh, okay, okay. Okay, this is just really, I'm just really concerned about how do we get those numbers up? And so obviously it's a federal grant, the HCCBG, but the county dollars are coming straight out of the general fund. Is that correct? So it would be, okay. I just couldn't tell if those heads were nodding up and down or not. Okay, so that would be an increase of our budget. And yeah, wow, okay.
That's
And-
correct, Commissioner. And then if I could tag on, so for individuals that have the ability to pay, there are other adult daycare service options available in the city and in the county. Again, these are the county-supported
Mhm.
initiatives. We have contracts with those 6 agencies through our initiative, but individuals who can private pay or have other resources, there are many more
Sure.
facilities available to
But I
support
bet
that
they're
work.
not at the same rate. That's the thing is
Well,
we have the
absolutely. I
people in
mean,
the
our-
middle. who-
Absolutely.
Yeah,
Yeah.
so if they were able to go out and get it for 21,000 a year, they might do that, but they probably couldn't. Is that
Yeah,
correct?
that's, well, I don't know specifically with the individual situation, but I just wanted to make sure it was clear that these are not the only adult daycare center options available in the county.
Okay, so if you have the means to pay, you will find others that have availability.
There are
Is
others
it kind of like
available.
childcare where it's really hard to get because there's just not enough? Do we know?
There are other adult daycare options available, yes. I'm not sure about the total capacity of the county. I suspect it's just as strained as the childcare dynamic would be as well, because when you think about our increasingly aged population and what we're facing with the numbers ticking up, I suspect, but don't know for sure though, that we probably don't have enough throughout the city and county, whether it's county supported or just a private entity.
Okay, thank you so much.
All right, just to follow up, the APS stuff I got, that's just mandated. I mean, when you get a referral, you got to respond to the referral, whether that's a child that's being neglected or abused, or an adult that's being neglected or abused, or could be, you have to respond. So I got that piece. The part that I don't got is the inquiry list. If you APS, the inquiry list is not APS.
Correct. Yeah, APS would
okay.
not go on the inquiry list.
Okay, all right, because I'm going to say you were mandated to serve those that
Correct.
come through APS. All right. So inquiry are folk who have a need, but are not necessarily being served at this particular point.
That is correct.
Okay, because of funding. The adult daycare piece that we did here doing the budget presentation, I certainly understand that. But we always talk about economic development. We also talk about quality of life. And just as we have daycare for working families that don't necessarily meet the minimal standard for state aid directly, we do try to provide, to the extent that we can, resources for daycare. Is there some sense from your engagement that the adult daycare is economic development? Is it allowing family members to go to work, or how would you characterize that relationship? Because there are two things from my observation. One is just simply quality of life. And that's just, there are two groups of people that I will yield that's children and seniors. I'll soon be one of those seniors, but those two groups, we ought to find resources to help. But help me with the economic development piece. I kind of feel that, but I don't get it from you just yet.
And yes, adult daycare does allow for the caregivers either to work or have respite, just as a break from their caregiving responsibilities. We noted in the presentation that typically our participants are able to go up to 5 days a week. So that has been really helpful, for our caregivers to ensure that they have access to services that allow them to work or engage in other activities. As Ms. Henderson indicated, though, that there might not be enough, to fulfill that need across all of the aging population within the county.
Two questions. I didn't time myself. 2 questions. All right, a quick one. In terms of quantity and quality, I know you talked about rates being increased. Oftentimes childcare rates are the lowest. I would imagine adult daycare or these other rates are fairly not as competitive as they ought to be. Is there any consideration from the program to look at ways to increase funding? Because I saw there was a $300,000 decrease. At the same time, there was an increase to $84 per day. I mean, how can you increase it to $84 a day and you get a $300,000 decrease? Or am I looking at that wrong?
You're correct. The reimbursement rate increase was effective in '23, and the board supported that increase. The $300,000 shift that you see reflected for FY '25 is based upon the increased need to fund in-home aid services. And so in our FY '25 budget request, we were able to realign that funding to support in-home aid. However, I would venture to say our FY '26 request could look different, but we have to evaluate utilization and demand and see where we are. But the confluence of the increase in reimbursement rates and us pulling individuals off of the inquiry list during COVID, all of that resulted in an overspending, frankly, in in-home aid that needed to be calibrated and responded to by pulling adult daycare funding to balance that out so that we basically staying flat for the most part. But then there is an opportunity in '26 to evaluate it again.
Well, my 2 cents worth is trying to find a way. I'm sort of predisposed to, in our January retreat, to kind of drill down to see how we can be more supportive. And if that requires an increase in county funding, that's just something that we have to tackle with all the rest of the increases that come to us. But clearly those 2 bookends, children and seniors, we need to figure out how to be more supportive, I think, as an organization. I think you guys are doing a great job with what you have. But if you can make a presentation during our retreat a little bit deeper than this one, it would be appreciated from one commissioner's perspective. Okay.
Thank you.
All right. Let me go back down the line to Commissioner
you.
Meyer, then Commissioner Rodriguez McDowell.
Just for the adult daycare programs, we partner with 6 of them. Do they all cost the same for us? And do they cost the same for people who are there privately?
I'd imagine that the pay rates for private pay are different. They also have individual participants who receive funding through the VA, long-term care insurance, the CAP DA program, which is out of the health department. So, and those rates may vary.
So when you go to, find new partners, are you having to keep yourselves at a certain amount per? And then
Yes, this is our negotiated rate.
okay. So it's your negotiated rate with these, are they kind of
That's our
taking a,
standard rate.
okay,
If there was a new entity, unless we got increased funding, it would be at those same terms as the other 6.
okay, all right, that's all, that's it, thanks.
Susan?
Thank you. Yeah, so is this another one of those places where the state has a responsibility and we are supplementing, or do they have any responsibility in this area?
The state provides some funds for adult daycare services. They do not provide funds for in-home aid directly.
Okay, and how is that breakdown? I don't see that on here, do I? Did I miss it? Like, is it a per
'Cause
person?
It's combined state and fed.
State
Oh,
and
I see.
federal for
I'm
adult
sorry.
daycare.
See that little minuscule amount?
Yes.
691, that's
So
the entire
HCCBG and state federal are generally flat funded.
flat funded, meaning it hasn't
The
changed in
same
years?
amount, yeah, roughly the same amount year after year.
Wow. Okay. And that's combined state and fed, the 691,000.
Yes.
And, okay, so that's, oh, so in-home is 0 from the state.
Even for adult protective services mandated, the
Correct.
state still doesn't give money.
That's correct.
Wow. Okay. One last question. Oh, go ahead.
No, just to follow
Sorry.
what Susan, I mean, you just raised a question.
Mhm.
When you present again, do the demographics as well as the trend line. You know, are we trending up or down? Is the need trending up or down? And how are we matching whatever that trend happens to be? Because as Commissioner Rodriguez-McDowell indicated, for the APS, the mandated services, clearly we need to talk to the delegation about abuse and neglect, if that's a statute,
Yeah.
how the county can be reimbursed at a different rate as one item. And then the second item would be in terms of the need over time in both programs. I just have a sense because the census data is clear. Mecklenburg County is getting grayer.
Correct.
So the quality of life for those folk who are getting grayer, we need to try to figure that out, whether it's state, federal, local, or some combination of the two. But clearly, the APS stuff that's mandated by the state, we need to be more assertive, I think, with the legislative delegation as a concern. Susan, I'm sorry. Go ahead.
No, not at all. I appreciate that. My one last question was about the agencies. This is for the in-home aid. I think you indicated that they get 3-year contracts with an optional 2-year extension. Are they like, lining up to be next, or is it a sought after type of thing, or?
It is now.
So
I
there's
think
more.
because we increased our rates and then we required a certain threshold that the agencies pay their aides. I get frequent calls from agency owners and managers asking to engage. So yeah, we've been very fortunate in 23 to have solid in-home aid agencies who are able to meet most of the needs.
Okay, because what I'm trying to figure out from that is that means that the amount that we're paying, it is market rate or close to market rate to where they want to work with us. It's not like they're just like, oh, we'll just take some from the
Correct.
county.
Yeah, when we were at $22 an hour, people were turning us away. It may take weeks to fill, to find a staff person for that agency to find a staff person to even serve an APS individual.
Okay, and so
was
just that bump
struggle.
to 30 was enough to, wow, okay. All right, thank you. That concludes my question.
Go right ahead, Susan, and follow up with adult daycare. $84 a day divided by 8 hours.
Yeah,
Okay.
yeah.
I mean, you're back in the same ballgame in terms of quality of care. So, I mean, for whoever it is, the state held the rates down for 18 years.
Sorry, Commissioner, they had a cap on the individual county level flexibility to adjust those rates. And so that was lifted, and now each county was able to evaluate and establish a rate.
Well, when y'all present again, and I don't know, we all get a chance to put our wish list together about during the retreat. But a deeper dive would be interesting in this particular area because it's the beginning of life and the end of life. The quality of life is so important. And this is something that I think the community would be interested in as we continue to gray and to be creative, to find resources. Because I just voted for a world-class city to have the arts. And a world-class city to me also takes care of those most vulnerable. And so I think there'll be others having interest in the question, can we do better? So that's my 2 cents for this presentation, unless my colleagues have some additional questions on this particular item.
I just want to say that the more we know, the board knows, the more we can advocate. And so this really has been valuable. I didn't know any of this, particularly the state gives no money for in-home care. I mean, that's criminal to me. And we, that's something we can scream our heads off about. Might be into the void, but we can still scream. So.
But also help us with that argument in terms of what does it cost for institutionalizing our seniors versus the quality of life and an adult daycare or what's the other one? In-home aid service. I mean, just say, hey, what are we saving by doing this, both in terms of funds from potentially being institutionalized to quality of life with a resident being able to stay at home. Yeah.
Thank you so much.
Thank you. Thank you so much. We have our third commissioner here, so we can try to go back to the agenda item. There's one ma'am.
I'm on this committee.
Yes, ma'am. That's
Thank
why I
you.
said we have our third member here that can help us make a quorum so we can take care of our official business, which is passing the minutes from the previous meeting.
So moved.
Is there a second? Second? I'll second that motion. Any discussion? Hearing no discussion, all those in favor say aye.
Aye.
Aye, the ayes have it, by our Robert's Rules of Order. If you're present, that's a yay. So thank you. Commissioner Leek, we are about ready to adjourn. We have completed the presentations by both of the phenomenal staff members on adult daycare and in-home aid presentation. Great information. We apologize that you're here, but if you have any parting comments. All righty, with nothing further, is there a motion that we adjourn?
So moved.
All right, is there a second? All right, all in favor say aye.
Aye.
Meeting's adjourned. Thank you all for your attendance and excellent presentation. I'll do my bit in terms of lobbying for a deeper dive during the retreat in January. Thank you, everyone. Thank you.
Thank you.
Right.